Hello everyone and welcome back to the Radical RN channel. Today's topic is vitamin D. So vitamin D, what is it? It is a fat-soluble vitamin that is needed for normal hormone function in the body. So I wanted to go into also what is a hormone. A hormone is a chemical-like substance that acts like a messenger in the body to all the cells in your body. So without vitamin D, your cells wouldn't be able to work in the right way. And you need fat in order for vitamin D to be absorbed and used in the body. And it also accumulates in fat tissue if you have too much of it. There are two types of vitamin D. Vitamin D3, which is the active form, and D2, which is the inactive form. So D3 is more potent and it is made from the body through exposure of the skin to UV lights and UV rays from the sun, and it's also found in some foods. Some of the foods that vitamin D3 is found in is fatty fish like salmon, mackerel, herring, cod liver oil, and of course other fortified foods that have vitamin D in it like orange juice, milk, breads, and cereals. And it is more potent and binds more efficiently to the proteins in our blood and in our plasma. So it's more readily available to the tissues so that it can be utilized. Now, D2, on the other hand, is a more synthetic form. So it was made in the lab, and it isn't the type of vitamin D that is found in the bodies. It's found in the body, the human body, but it is found in trace amounts in plants. And so it has been, everyone is different on, like the practitioners, they all have different views on what should be used, vitamin D2 or vitamin D3 with supplementation when someone is deficient. So from the research that I did, vitamin D2 has been found to increase the levels of vitamin D, which is great during supplementation, but for 2 weeks. And then after that, it starts to taper off for the next 2 weeks down to the levels of vitamin D that it was previous to supplementation. That was with D2. Now with D3, when they supplement with it for 2 weeks, the next 2 weeks after they stop, it continues to go up. So it's, some people believe that vitamin D3, since it's the active form, it's the most natural in our body, then we should be supplementing with that. So that's what I supplement with. I want to let you know also a disclaimer that anything I say on these videos is for educational purposes only, and if you are thinking you have vitamin D3 deficiency, then talk to your doctor and see what would be best for you, because it does have some side effects if you take too much, and we'll get to that in the videos. But it's important that you talk to the doctor before you start anything that I talk about or recommend, because I am only an RN. I do have experience in the natural side of healthcare and integrative side. I do have education, and I am a certified lifestyle educator, but I am not a doctor, so I cannot diagnose or prescribe or treat disease. So I just have to put that disclaimer out there in the middle of my video. I should have done that at the very beginning, but just getting started. Okay, moving on. So why is vitamin D important for our health? It's important because it helps the absorption of calcium and phosphorus, and so it increases calcium levels in our blood. And then it also promotes bone mineralization and remodeling, so it's very, very important for the health of our bones. It's also important in our immune system and our neuromuscular system and for cellular function, like we said earlier. So I'm looking at my notes, so let me go to the next page. So what are some symptoms of vitamin D deficiency? Softening or deformation of the bone. Some people will see it in kids early on, and it's normally from a vitamin D deficiency, but also adults can get that as well. Muscle weakness, dental abnormalities because teeth are bone too, chronic low back pain, general aches and pains, tension headaches, excessive skin sensitivity. So if you're sensitive when someone touches you, if you get numbness, tingling, lots of different sensitivities with touch. Fatigue, head sweating, and it can also easily manifest very similar to fibromyalgia, depression, and chronic fatigue syndrome. So if you have any of those, it would be worth talking to your doctor and getting a vitamin D blood test to see where your levels are at, just to see if you are deficient. So what makes you at risk for a deficiency? A lot of people have deficiency in the fat-soluble vitamins because of malabsorption issues from gastrointestinal disorders. So think of people like with celiac disease, with small intestinal bacterial overgrowth, and gallbladder problems, because without bile we can't absorb and do what the body needs to do with vitamin D without that. Because if there's decreased fat absorption from the bile and from malabsorption in the intestines, then you can't absorb vitamin D very well, as well as the other fat-soluble vitamins like A, E, and K. Another thing that will make you at risk for a deficiency in vitamin D is genetic mutations that affect how your vitamin D is being synthesized or made from exposure from the sun. Also living in the northern states and at a higher latitude where you don't get as much sunlight, because sunlight passes through more ozone and the ozone absorbs the wavelengths that are converted into vitamin D in the body. So when you live in those higher areas in the northern states, then you're just going to be getting less of those vital UV rays that we convert. Also, on the same wavelength, living in a place with tall buildings that block the sunlight, obviously you're not getting as much sun. And then also for those working indoors for long periods, I am, yes, thinking about the nurses and doctors and other healthcare practitioners that work 12 plus hours a day, and especially on day shift. And when you're on night shift, you know, you're missing that. So anyway, moving on. Pollution also blocks the wavelengths of UV rays. So if you live in a place with tall buildings, you work a long shift, and there's pollution in your area, then you're at a pretty big risk for being deficient in vitamin D. Also vegans, because their diet is very low in vitamin D, unless you're getting some of those fortified foods, but it would be mostly in, you know, orange juice, breads, and cereals. And the elderly, of course, because they just can't synthesize it as much, or they also have malabsorption issues just naturally as you age. So, and also if you have a lot of inflammation in your body, thinking of autoimmune conditions or just inflammation in general, inflammation decreases vitamin D levels as well. So, talking about the risk of deficiency, what can you do to prevent it from happening or to even treat it? So let's go with the natural things first, what you could do without supplementation, without going to the doctor. So you can expose your skin to sunlight. So exposing your face, your legs, your arms, and your hands for 5 to 15 minutes during the day from 10 a.m. to 3 p.m. And you only need to do that 2 to 3 times a week in order to synthesize or create enough vitamin D to be able to support your body. And that's only during, summer, spring, and autumn. Obviously, during the winter, you'd have to spend a lot more time outside, as well as if you were trying to be outside before 10 a.m. and after 3 p.m., then you would definitely need to spend more time than 5 to 15 minutes. But obviously, this varies with each person. Obviously, if you have a skin disease or a sensitivity to sunlight, you have to weigh those into consideration, talk to your doctor, see what would be best for you. Maybe increasing your food or supplementing would be better for those people, or people that have genetic mutations that don't allow them to synthesize vitamin D as well from just skin exposure. So, and then some food sources, the best sources, as I think I said a little bit before, that is fatty fish like salmon, sardines, and herring, and smaller amounts in egg yolks, cheese, and beef liver, and then obviously in the fortified foods I said. And then another way to treat deficiency is to supplement. So again, please talk to your provider before supplementing. And this is another thing that is controversial in this topic, is taking vitamin D with K2. So there isn't a lot of studies around this topic. Some people believe that yes, we need K2 with vitamin D3 because D3 causes increased calcium in the blood, and it can lead to other complications like kidney stones and heart problems, and also calcification or increased calcium in the blood vessels, which could create blockages later on. And K2 actually creates, it stimulates something in your blood called anyway, I'll find the word and I'll put it in the show notes below, but it creates something that allows calcium to be put back into your bones, so it would prevent osteoporosis and all of that. But again, it's controversial. I personally take vitamin D3 with K2, so again, talk to your doctor and see what would be best for you. All right, so moving on. If you are supplementing, I just want to make sure that I don't miss this. If you are supplementing, it's also important to have your doctor monitor your blood. He or she probably already knows that, but just to make sure that it doesn't go too high or that you're actually absorbing it, and there's a lot of factors that go into it. So with supplementation, there is a risk of toxicity, so very high levels of vitamin D in the blood. So there are some people, just like they can't genetically synthesize vitamin D in the skin, there is some people genetically that can't break down vitamin D. So that's another thing to take into consideration. If you can't do that, then your levels are going to go to a very, very high level that could be concerning. So I also wanted to say that there are a couple people that are more sensitive to vitamin D, and those are people with tuberculosis, sarcoidosis, and Hodgkin's disease. So the main side effect or adverse effect of vitamin D supplementation is it increases the calcium levels in your blood and urine because it helps the absorption of calcium in the intestines. It can cause anorexia, nausea and vomiting, increased urination and increased thirst, and cardiac arrhythmias. So your heart having abnormal beats. Okay, and some drug interactions that are important to know is if you're on anticonvulsants, it also promotes vitamin D deficiency because it activates liver enzymes that render vitamin D useless. So you might need to supplement at a higher dose in order for it to be worth it for you to supplement. Those with anti-tuberculosis drugs, it interferes with vitamin D metabolism. So again, you might have too low of vitamin D when you're taking those drugs. Aromatase inhibitors, bile salts sequestrants. So when you take those, it decreases the bile that is being created in your body. So it decreases the absorption of all the fat-soluble vitamins D, E, A, and K. If you're taking digoxin, which is a heart medication, it increases calcium and can also increase your risk for arrhythmias. So the way your heart beats could be unusual. Glucocorticoids, they decrease vitamin D levels and can cause bone loss. Hydroxychloroquine, it stops vitamin D conversion to the active form in your body, as well as statins. Statins can produce statin-induced muscle pain, and it also can decrease vitamin D levels as well. Okay, and that is it. I hope you enjoyed listening, and if you have any questions, please leave a comment below and like my videos as well to get it spread out there. And also just reach out to me. I want to be a resource to you and help you along in your health journey. So without further ado, have a wonderful day, and we will see you next time.